Guys, this is our public health presentation. My name is Muhammad Islam.
My name is Tamid Ahmed.
My name is Shab Kamal.
And my name is Ahnaf Sami.
And our topic for today is reducing health disparities.
The question that we're going to try to be answering today is, what can HOSA do to address the social determinants of health in your community?
First, let's understand what are SDOHs. Social determinants in health are conditions in the environments where people carry on their everyday lives that affect a wide range of health and quality of life risks and consequences.
The 5 domains of social determinants are as followed. 1. Economic stability. 2. Education. 3. Healthcare access and quality. 4. Neighborhood and built environment. And lastly, 5. Social and community context.
Economic stability. Economic stability is the connection between financial resources and health. Healthcare in the United States should be a civil right, but in this country, it takes a hefty expense to provide for it. Issues concerning economic stability are such follows: cost of treatment, transportation to the hospital, bill that cannot support the income, cannot be supported by the income, and with all the following, it can cause many people to fall in debt. Employment in the U.S. varies. 45.7% of all Americans are part of the working class. 3.6% of Americans are part of the upper class. 7.3% of Americans are part of the lower class. And 43.4% of people are part of the middle class. With disparities in employment in classes, it causes many problems in the healthcare system with many people that lack the ability to afford. And through the diagram as followed, we can see that many people struggle to pay for their housing and have trouble in crowding, plumbing, lack of kitchen, and etc.
How does education impact a person's health? Education impacts a person's behavior. In fact, 21.7% of adults with high school diplomas smoke compared to 5.4% of adults who have graduate degrees. Second, income. Every additional year of schooling leads to 11% increase in income, and this allows people to be able to invest into living a healthy lifestyle compared to others who cannot because of the income level. Third, employment. People ages 25 and over who lack a high school degree have an 8% unemployment rate compared to a 2.8 rate among people who have a bachelor's degree. And fourth, life expectancy. People who graduate from college live at least 5 years longer than people who didn't finish high school.
Healthcare access and quality. The importance of widespread healthcare. The healthcare system in the United States is uncoordinated and fragmented and emphasizes intervention rather than prevention and comprehensive health management. Healthcare is not easily accessible and as a result leaves a large majority of people helpless in a time of crisis. The percentage of uninsured Americans is near 15%, with nearly 50 million people uninsured, which is unfair and inhumane. Some possible plans to improve the U.S. healthcare. There's a lot of work that needs to be done, but the way that current medical providers can help is as such. Increase spending on primary care, stop focusing on sick care, and use technology to help improve access and reduce costs. Now, to emphasize the first point, some ways that private medical providers can help is by allowing primary care visits without a deductible, or at least a limited number without a deductible. Some ideas to be given out. Continuing on, current medical providers can utilize some of these steps to prioritize patients and foster a healthier environment. The most ideal scenario would be for the U.S. government to establish free healthcare for everyone, but for now, this is as close as we can get to a fair healthcare system.
Neighborhood and built environment. Now, with neighborhood and built environment, there are 3 examples in which it is impacted. For example, for race, people of color are those who suffer mainly from inequality. And with that in mind, a large majority of these people do not have the resources for safe health. And then adding on to that, many neighborhoods need assistance in order to meet their medical needs. Now, moving on, in terms of poverty, neighborhoods which lack money equal lesser quality healthcare. Now, insurance is crucial in neighborhoods which suffer from poverty, and from this, we could draw a link between race and poverty because a person of color is more likely to suffer from it than a person of who is white. Adding on, quality healthcare is also impacted with reference to certain neighborhoods. Many neighborhoods have the healthcare but lack the quality. Many of the professionals do not have the accurate training to treat people, which may be detrimental for the health of people who are treated. And now this results in individuals with low quality healthcare, which should not be permitted whatsoever because it is high stakes. Moving on, our social and community context. In terms of social community context, there are many subcategories, and one of which is connections. Now, certain people may have better connections than others due to privilege, especially among Black and Hispanic communities, which lack these resources. These connections are not present due to the due to the inequality that is present. Now, many quality institutions are not present within these communities, which is an example of the privileges many of these white communities may have over Black and Hispanic communities. Now, adding on, discrimination is a given. And in terms of social connections, many people of color may feel disadvantaged. Now, these people do not have the proper connections, which is an example of discrimination that may be present. And this may have to do with skin color. And as a result, this results in low quality healthcare with no fundamental reason other than the fact that their skin color is different from someone who is white. Now, adding on with the rates of incarceration, those who are incarcerated lack proper healthcare due to community that were there within. Now, prisoners do not have the proper resources in order to have proper healthcare. Now, with relation to connections and discrimination, it are the people of color who are suffering from it mainly because these are the people who are incarcerated at higher rates, other than those who are white colored.
There are many solutions that can be taken to prevent and spread awareness. Before everything, we must stress the importance of awareness. Firstly, you must ensure that everyone is aware of the ongoing problem of health disparities amongst communities. Awareness can be done in many forms, such as advertisement and widespread programs. These programs can vary and include informing the uneducated. After awareness to the public, this will then allow people to acknowledge the problem. First, by raising awareness, this can lead to expanding health insurance coverage, improving the capacity and number of providers in underfunded communities. Taking into account of the social determinants, the community legislators must provide legislation and policies to counteract the problems. Next, we can see that there are other solutions such as the CDC Community Health Improvement Navigator. The CHI is a process in which the CDC provides ways to identify and address the health needs of the community. It takes a holistic approach to community and identifies multiple variables that combine to cause problems. Identifying causation. The more that people are exposed to negative experiences and values, the higher the chance that they will engage in those risky behaviors. By mitigating the negative experiences by identifying them and creating early recognition, we can lower these problems. And lastly, help without being in the medical field. People can still help without necessarily being in the medical fields by donating to local charities, supporting small businesses and small communities, and spread ideas on social media.
That's it for our presentation. Thank you guys for listening, and we hope to use this presentation as a means in order to improve the healthcare in our communities and in the future. Thank you for listening.